So hear me out. I know I'm just a physical therapist, but I feel like we can add some value to the decision making if you're going to have surgery or not, or things you should consider before having surgery. Take it for example, when you go to buy a car. Like, would you rather talk to the salesman that's trying to sell you the car, or the mechanic that actually fixes the car and sees how often it's in the shop and what needs to be done to maintain it? And I would consider myself the person you should be talking to before surgery if you're considering having back surgery. So there are definitely situations that you need surgery, but in most people, the decision to have surgery is kind of gray. It's really important to make the right decision because you can't go back, but there isn't a clear-cut reason to have surgery. Now, I'm going to go over 5 things that you absolutely should be considering, but the actual decision to have surgery is kind of gray. So what I want to do with you is share what I've learned over the past 10 years of working with patients who've had surgery and who haven't had surgery, and what's the research say, and try to find this area of compromise of you're making the right decision because you're checking these boxes, but also you have confidence in your next step. So hopefully these reasons and these different things that I'm going to talk about give you some confidence in your next step forward. Now, at the end of the video, I'm going to be going over things if you're like, hey, I'm going to have surgery, what are some things and tips and tricks that I need to be doing to set myself up for success? I'm going to be going over that at the very end of the video, and that's going to be really valuable. But before we do that, let's go over the top 5 reasons why I see people have surgery and things that you definitely want to be considering before you have surgery.